My Lords, I rise to speak to Amendment 151 in my name in this group, and it is a slightly diverse group in that the Noble Lord, Lord Kamal, has just set out his two amendments, which are very focused on specific areas. Mine is a very general one, but they do fall under the grouping as provided to us by the WEPs of they are about monitoring and reporting, so there is some kind of sense here. And I'm going to start with the words of the Noble Lady Baroness Tyler in the previous group. Without proper resources, this bill is not going to work at all. And that's what this amendment aims to address. And to address specifically, and I think this is why it was regarded as within scope of the bill without any wrestling from me, the aim of this bill is to get fewer people to be sectioned, fewer people under compulsory treatment orders, to reshape and have earlier intervention and see problems not get so bad that we get to that point. What is going to be essential to make that happen is resources in the community. In day one of committee, the Noble Lord Kamal gave me a task to go off and find out a briefing about what I would label the Trieste model, which is probably the world-leading a place where this approach of community resources is best known. I'm still working on that. We'll get there eventually, not quite there yet. That's really what this amendment aims to do, for Parliament to get a continuous assessment every 2 years after the Act initially, then every 3 years thereafter. What is really, I think we have heard through many stages of the debate of this committee, the most important thing, to be able to have a report and assessment democratically heard by Parliament, government forced to make an assessment on a regular basis, what level of resources are available in the community. And that's what this review amendment is seeking to achieve. And in thinking about this, I think it's really useful. A survey from Ipsos from last year, which has reported in The Guardian, was headlined, "Mental health overtakes cancer and obesity as Britain's biggest health worry." This is now of greater concern. Mental health in general is more concern to British people than is cancer or obesity. We think about that and we think about the phrase parity of esteem and how far we are in terms of both community services and other higher level services in terms of mental health versus physical health. I think it's really worth saying, and that's what this amendment's aiming to do, is to get an assessment that people can see and hear and listen to and look at all the way along. Just a couple more points, because I do think this is an important amendment. I draw attention to the Local Government Association briefing and declare my position as the Vice President of the Local Government Association. It notes that the bill impact assessment does not identify any increase in demand in community health services aside from advocacy. Nothing is in the impact statement of actual services. Now, the LGA says to achieve this reform successfully, it will require investment in both voluntary community and social enterprise and council-commissioned community health, mental health services. They note that this is particularly important as statutory local authority adult mental health services and much VCSE mental health provision is funded from the social care budget. And we all know what pressure that social care budget is under. Just a couple of other things very shortly to say. Thinking particularly, we've just been talking a great deal about children and young people. And I note that the briefing from Mind, in partnership with the Children and Young People's Coalition, notes that waiting time and thresholds for mental health support for children and young people across early intervention, targeted support and clinical access services are worryingly high. And as they say, too many children are now being left to get to crisis point, when we're aiming to achieve the absolute opposite. That's the whole purpose of this bill. And I'm just going to cite one final statistic, well, actually two final statistics. Widely reported last week, the number of young people admitted to general hospital wards in England with a mental health concern is up 65% in the past 10 years. So we have mental health problems, but people are ending up in general wards where they simply do not have the services and the provision very often to meet their needs. And just one final thing, because I think it's an area that really deserves a great deal more attention. Perinatal mental health assistance, very often for mothers, the last figures from, I think, running into the middle of last year, across England, 62,700 people were provided with perinatal mental health assistance. Oh, it's in the year to November. That was a 16% increase on the preceding year and 30% up on 21-22. So we need these services in the community across so many areas and in so many aspects. And if we're going to deliver this bill, those services have to be there. And surely Parliament should be able to make a regular assessment of what provision there is, and the government should really have to account for that.